So we're going to walk you through what happens during the initial assessment process. The initial assessment, also called the new patient exam, happens in 2 different visits. So the first visit, we do a very thorough health history. We want to find out what kind of accidents, injuries, and traumas you had in the past that has kind of got you to this point where you're needing care, or at least diagnosis. So in this first visit, we go through the health history, and then we do 2 state-of-the-art nerve scans. Now, these nerve scans are very comprehensive and accurate. In fact, the electromyography that we do measures down to 1,000th of a volt. So it tells us how well your brain is running all of the paraspinal muscles and the nerves that branch out from your spine. We also do infrared thermography that helps us figure out how well your brain is running the organs, glands, and tissues. So that gives us a window into both your nervous system and the muscular system. Then after we do those tests, we take in-office digital x-rays that measure down to 1/10 of a millimeter. They're very specific. We can blow the vertebra up to the size of a bus and they don't pixelate because we want to find out exactly what's going on with the bones and the discs. We want to look at the shapes and the curves and see what the degenerative processes are that are going on in your spine. Then after we do this, before the second visit, I sit down with these things and I compare your x-rays with your nerve scans and kind of come up with a picture of what's going on. Then during the second visit, which is another half an hour visit, we sit you down and we teach you how to read generic x-rays. We show you what normal x-rays are supposed to look like and why they need to look like that. And if they don't look like that, what happens to the bones, the discs, the muscles, the nerves, your pain levels, and more importantly, how your spine and nervous system ages. And once you understand those concepts, we get you to read your x-rays to us. That way, we know that you understood what we're talking about. And that's really what informed consent is. Informed consent is not just signing a piece of paper. It's truly understanding what your healthcare provider is talking about so you can make the best decision on what you should do. Because we need to focus on what your wants and needs are, right? That's the most important thing. We want to try and help you get what you need. And if we can help you do that, great. If we can't help you do that, then we'll point you in the appropriate direction. So the second visit is very thorough. And after you understand what your x-rays look like and you read them back to us, then we say, okay, Mary, Bob, John, Phil, this is what we would do to try and help you get back to normal and prosper in the future. This is how we would tackle the disc degeneration, the arthritic activity, the spinal curve loss, the inappropriate aging of your spine, and we would set a rehabilitative protocol with decompression and chiropractic care to get you back to the strongest version of yourself. If this sounds like something that you would like, then please call us and book your initial assessment. We're very thorough and we'd love to look after you. Thank you.